One of the things that's often missed out is endometriosis, which tends to affect a very significant amount of women who have fertility problems. Endometriosis, very broadly speaking, is the lining of the uterus that's growing in the wrong place, somewhere inside the abdomen, maybe around the ovaries, behind the uterus, on top of the bladder, but basically it's in the wrong place. The exact mechanism by which endometriosis affects fertility still remains unknown, and there are many theories. But at the end of the day, if there is endometriosis, it gets significantly harder to get pregnant by whatever means, naturally or by any form of fertility treatment. One of the big difficulties we have with endometriosis is making the diagnosis. The diagnosis is not, there's no simple way of doing it. We don't have any blood tests, we don't have any radiological imaging. It has to be done, unfortunately, by surgery. The other difficulty is there are often no symptoms. One of the symptoms of endometriosis is infertility. Okay. There are associations with pain in different forms, with during the periods or at other times, pelvic pain. But at the end of the day, the way to diagnose that is through a laparoscopy or keyhole surgery. And if the endometriosis is treated surgically, it makes a world of difference to subsequent outcomes from any form of fertility treatment, and to a great extent, even to natural fertility. So if you have someone who's about 30 years old and has been trying, as far as we know, they're ovulating, the sperms are fine, and there's no blockage in the fallopian tubes, and they're going, a couple of years or 3 years. I'd often insist, particularly in the younger women, that we actually exclude endometriosis, that we do the keyhole surgery and make sure that's done. Very often I find that we've done the surgery, cleared up the endometriosis, and lo and behold, they never needed any fertility treatment other than that. They'd get pregnant on their own. Now, one particular one I can remember is walking down South Bank on Mother's Day with my wife and kids after a Mother's Day breakfast. This lady says, "Oh, hello, Dr. Das." And I couldn't recognize her because I'd only seen her once or twice, once for a consultation, second time for a surgery, and third time for a post-operative review. And this was like 5 or 7 years ago. And she says, "You see these in the pram and the other one?" This happened straight after the laparoscopy, after you cleared the endometriosis. So it's nice. A lot of the patients you just don't see, but they achieve their pregnancy without that hard, difficult IVF, other forms of fertility treatment. So endometriosis is something that I often look for quite early on in the investigations of fertility treatment. And I tend to be quite aggressive with the treatment because the outcomes after treatment are just phenomenally good if you can treat it well.